With all our hearts, we pray and ask, God bless Anambra, God bless the shining light that we bear. We're the only ones to make her brighter, the only ones to make her better, the only ones to make Anambra shine. With our sweat and blood, we breathe of our life.
Hello and welcome to another exciting episode of Eyewitness Chat, where we bring you factual information about the happenings in Anambra State. They say health is wealth, and today we'll be talking with the Executive Secretary, Anambra State Health Insurance Agency, Dr. Simeon Onyemaechi, and I'm Iwitness. Do join us. It's a pleasure being with you, Dr. Simeon. So let's start with the fundamental question. What's ASHIA all about when we talk about the Health Insurance Agency?
Thank you, Iwitness. ASHIA is Anambra State Health Insurance Agency, as you had rightly said in your introduction. Anambra State Health Insurance Agency, I would like to define it clearly as an avenue to bring quality health care to the doorstep of everybody who resides in Anambra, and to make such quality health care affordable, accessible, and equitably distributed everywhere in Anambra, such that the son of a peasant will be able to afford similar quality of health care as the billionaire who resides somewhere in Onitsha or in Nnewi or even in Lagos. And that's a pillar of trust of His Excellency Chief Willie Obiano. So His Excellency, coming on board, decided to do something that will outlive him, not just thinking about the present, because accolades won't mean anything to him. Absolutely. For him, he's gone ahead. This is not a policy statement of government. He has done the primary thing which usually is missing in most of the policies people put up for government. His Excellency Chief Willie Obiano has ensured that there is a law setting up an agency to implement Anambra State Health Insurance Scheme in a manner that will be sustainable, whether His Excellency Chief Willie Obiano remains governor or he completes his tenure and leaves. It's established.
That was actually one of the reasons, one of the things that led to my thinking to now sponsor the health insurance bill. That means that every month you pay a small premium that will now guarantee you access to affordable care in Anambra State. There will be no issue or problems of maybe when someone is sick, you go to the hospital and the doctor or the hospital will ask you to put a deposit of, let's say, 200,000 or 1 million, depending on the condition. Once you have that health insurance card and you get to your hospital, assigned hospital, once you show the card, treatment will start immediately.
You talked about quality health care for all, and I assume that certain hospitals will be accredited before they are qualified for the health insurance scheme.
Yeah.
So let's ask, what kind of hospitals are accredited? Is it only government hospitals, private hospitals, and how many thus far have been accredited?
Yeah, thank you. At this point, we have accredited over 260 health facilities,
okay,
both public and private, providing services under the Anambra State Health Insurance Scheme. It will interest you to note that there's no local government in Anambra, no matter how remote it may be, that does not have up to 4 healthcare facilities, both public and private, implementing the scheme. As far as Nzam, we have a healthcare facility providing services. As far as Umunze, there's a healthcare facility. As up there and remote as Amanuki, there's a healthcare facility. Going down to Odekwe, there's a healthcare facility. Across the state, up there in Ihiam, towards the Amoka axis. The state is actually saturated. So this is not a thing of the urban areas.
So it's reaching
everybody.
Yeah.
The over 260 facilities, we have our checklist for accreditation, adopted and adapted from what the National Health Insurance Scheme is doing, which we have used to accredit these facilities. The implementing scheme, it will interest you to know that all the major missionary hospitals in Anambra State are on board our scheme. It will also interest you to know that the 36 general hospitals the state government currently have are on board the scheme.
Because they're government hospitals, or because
not because they are government hospitals, because they have met the accreditation criteria. We didn't bring all of them on board at the same time. It was a phased approach.
Anambra Health Insurance Agency, because most of their beneficiaries registered with us. So we have quite a number of enrollees in this establishment. And since they started, they've been accessing care from here. And it's been a seamless relationship. They come in, you treat them, they go. And I mean, there's so many people are actually wanting. Somebody met me the other day. Hey, if I knew, I would have registered here. I'm like, don't worry. In the next 6 months, you can afford to switch on.
Now, all of the major private hospitals you know in town, in the state, are on board our scheme. So, it is a scheme that has ensured that there is equitable distribution of healthcare facilities across, accredited to meet basic minimum standards, and not just going for a one-off accreditation for them. That was the onboarding accreditation. It will interest you to know that as we speak now, my team is out. They are somewhere around the Onitsha axis, monitoring what is going on in facilities. Yesterday, they were somewhere around the Nnewi axis to do monitoring for about 6 different hospitals. So we are regularly going there without notice to ensure that, yes, whatever quality that we met on ground, whatever standards we met on ground when we brought them on board during the accreditation process is maintained. So all hospitals within the scheme are aware that we could come for spot checks at any time. That's the beauty of it for me. That way, you must maintain your standards. So when we say quality health care under the scheme in over 260 facilities, we have accredited, and we are sure that with the quality assessment that we do regularly, they are keeping to standards.
It's a noble initiative by the state. We are so grateful to the governor, Akpokue Bulubulu of Anambra State. And we're also so grateful to the Secretary General, Onyemaechi, for relentless efforts he's making to see that these new initiatives really working properly. And we are having a good time with them because it's something new. It's still on the making stage, but we're grateful for the noble idea. And a lot of people have benefited from such a noble idea, and which is really going to make the state number one in the whole country.
I have to use this opportunity to thank the Anambra State government for really introducing this particular policy into the health system. Since the introduction of this particular policy, at least I know when you have a pregnant woman in labor, most of the time there will be a situation where the woman will not be able to deliver vaginally. The only option remaining is cesarean section. But you will see people that will reject the cesarean section. Not that they don't want to go through the cesarean section, but because they don't have money. So since they started this package, at least I have had some cases of cesarean sections sponsored by ASHA. Cesarean section that ordinarily you won't get anything less than 120,000 anywhere in Oka here. But I've had cases where the patient under ASHA had cesarean section here and paid something less than 10,000 naira. It's surprising. I was saying, is this thing really true in Anambra State here?
Numbers will be important to the scheme for its growth. Let's find out what's the relationship with the leadership of major markets across the state, Christian organizations, traditional rulers. What's their response towards the scheme?
I've interfaced with them. All traditional rulers know about the scheme. We have taken it a step further to go into different palaces to talk to not just them and their cabinet members, but as well as people who they invite to such meetings. We have visited several palaces on this singular mission to still take it down. The President Generals of Town Unions, we have interfaced with them in their regular meetings, which they hold in their SATU Council Conference Hall. We have also interfaced with the markets, with Amata. To put it very succinctly, there was a time His Excellency had a meeting that wasn't supposed to be anything about health. But then we said to him, Your Excellency, you're having this meeting with the traders. We want you to please give us an opportunity to talk to them. And immediately we got into that hall. That was it for me. You can't demonstrate political will beyond that. I got into that hall. The moment he noticed I was there, he had to shut down what he was doing and insisted I spoke to them. So we engaged the marketers. The moment after I finished speaking, His Excellency came up to still say a lot more, which I didn't even say to them about the need for everyone to support the scheme. From that point, he set up an impromptu committee, which has been meeting. From that point, we have met actually about 6 different times. We have embarked on campaigns in the markets. We have engaged different market unions. Last week, Friday, for example, we were at the Obaru market. During their regular morning prayer sessions, we spoke to them, and the same day we registered about 17 people. That number is not so much, but then these are things we continue to do. We have gone to the Bridgehead market, their union, very supportive. We have spoken to them, and every Wednesday we go out to the market because they have their different sub-unions, have their meetings on Wednesdays. We deploy our staff to go there to still further sensitize them and get people enrolled into the scheme on the spot. So all of these stakeholders, we are working well with them. For the churches, we have actually sent out letters to them which they have read on the different platforms and altars in churches, and for us as an agency, can only be imagined.
Health insurance has come to stay in Nigeria through the National Health Insurance Scheme, and just last year, the Anambra State also embraced health insurance. This is because Anambra has come to realize that it is where to go in order to ensure the health of its citizens are guaranteed. There's no gainsaying the fact that there are a lot of diseases prevalent in a third world like Nigeria. There are no telling the fact that the economic situation in Nigeria contributes to negative health situations of our citizens. So it is just apt that the Anambra State government keyed into the national health insurance and started its own Anambra State Health Insurance Scheme. It is something that is praiseworthy, something that we should be grateful to our governor for observing and discovering and actually keen in aligning with health insurance. Because you see, until you get to the rural populace, you will never know what people are going through in the country. And when you go there, you will see that many people lose their lives just because of common illnesses that can be taken care of. And why do they lose their life? Because they are afraid to go to hospitals. Every person believes that going to hospital is so expensive. Well, I don't know which one is more expensive. Is it being ignorant that is less expensive? No. But the truth remains that Anambra State governor realized that if people are given the opportunity, the morbidity rate and mortality rate in the state will reduce drastically.
Based on what you say, it's very obvious that the insurance scheme is not just strictly for civil servants, but you said you've gotten market people involved. In increasing the number, what's the synergy with the private sector? Is it just strictly government funded, or you have the private sector also coming in to assist in the insurance scheme?
The agency came up with the adoption model, whereby people who have the means, the philanthropists and billionaires in the different communities of Anambra, will adopt, quote unquote, members of their communities who are indigent. You pay premium for them to enjoy the scheme because the government has set aside 0.5% consolidated revenue fund for the agency. But then to show commitment, like it's done anywhere in the world, not even in the UK, they tell you health for all, the NHS is not free. There are NHS tax people pay, and then there is still 20% private sector insurance in the UK. So when you have all of these, people contribute. So government has put down resources. His Excellency has matched word with action. We're not looking for the resources, even though we have scarce resources, but he has prioritized this. That's why I say political will is not lacking. There is that commitment, but we need private individuals who ordinarily people would call to pay these hospital bills for them at a very exorbitant rate. So come together. If you can pay for 10 people from your community, 10 poor people, pay for them. It's 120,000 naira per annum. If you can pay for 100 people, pay for them is 1.2 million. So in that regard, we have that a lot of Anambra who we have approached are doing that already. I must commend them. The traders team you asked me about the engagement. On this note, I will clearly say that the head or the leader of Amata in this state, Ewe Pudike, for example, has paid for about 350 lives in this scheme, and we have enrolled them.
May I appreciate the governor of the state for his efforts as regards to the health of the people. Actually, the doctor has been to Appreciate Market on 3 good occasions to sanitize traders as regards to the scheme, which I have done. Many of us have registered with them. I have my own my card with them.
Let's ask them one of the most important questions to individuals. How much is the scheme? What does it cost an individual? What does it cost a family?
Okay. It is a flat rate of 12,000 naira premium per annum. Per person.
Okay.
Now, if you have...
So basically that's 1,000 naira
per month.
Per person per month.
Yeah, every month you pay 1,000 naira, but then it's aggregated as 12,000 naira per annum. Now, for me, you can't beat that. Sometime 2 weeks ago, a woman had a cesarean section in one of the private hospitals in Oka here. And what it cost the agency was over 100,000 to pay for that procedure. Whereas this is somebody who paid 12,000 naira. The woman had to put it on social media. Someone saw it from outside Anambra and tagged me for me to see that something like that ever happened. So,
and what we enjoy under your scheme is a big relief for us. Imagine me coming to hospital every Tuesday for antenatal, I pay 150. Yes, you take it from our salary, but we don't feel it. Coming to hospital because of your scheme, I've made things easier for me and my family. At least we can walk in anytime. We don't have the burden of there is no money. We can rush in here and they render the service to us, minus whatever they want to minus, and we're good to go. So your scheme has really relieved some people, like those that deliver through CS through your scheme. A lot of bulk of money have been eased off their back. A friend of mine just paid 28,000 instead of 100 and something thousand. So I think the scheme is a very good one. I congratulate whoever that invested in it. That is very okay, at least for the people of Anambra State. I've seen something tangible that we can hold on to. People say Nigeria is bad, but at least this is something I've seen and say is good.
So this is the next question. What are the healthcare benefits that people have access to under the scheme? There's certain procedures or tests, medical evaluations that they will say the scheme doesn't cover. So under Anambra State Insurance, health insurance scheme, what does it really cover? Okay,
I will re-echo your sentiments with health insurance, because when I hear that statement, it goes to say people have certain biases about health insurance. Now, there's no place in the world where health insurance covers every procedure.
Okay.
Ours is not different. Okay. But suffice it to say that the benefit package we are operating in Anambra State Health Insurance Scheme takes care of between 65 to 70% of the day-to-day healthcare need of our people. So it ranges from promotive, preventive, curative to rehabilitative health needs. Now, for the benefit package, we have essentially divided into primary and secondary care packages. Under the primary, we take care of under 5 the common ailments. We take care of antenatal, labor, delivery. We take care of any febrile condition and all of that. For secondary services, we sure do take care of certain surgeries like cesarean section, fully, appendectomy, that is a surgery for appendicitis. We do herniorrhaphy for hernia, and several other things. Lumps, we do all of those excision and what have you. Then the range of investigations that we do, that is commonly laboratory tests.
Yes.
We cover lab tests for virtually anything that anybody would need, basically, apart from things that relate with cancers and what have you. But essentially, majority of the basic investigations to diagnose what medical condition any individual may be suffering, we have covered that. And then we provide medications for the things that we cover. So suffice it to say that what we are doing has taken care of primary health care fully and has even extended to specialist care. Okay? And if you juxtapose that with the statement of the WHO, which you can see clearly on their website, 90% of persons having full access to primary health care will live up to the life expectancy that is obtainable in developed worlds. So if you are able to take care of 90% of anybody's primary health care need, you have done all you need to do for that individual. That's what the World Health Organization says. And we have taken care of everything primary and then added on to secondary. That's why we are safe to say 65 to 70%.
How?
When I came to see a gynecologist, first of all, I met a medical officer who now referred me to a gynecologist. So he sent me for scan, ultrasound. After every test, so he discovered that I had fibromyalgia. And he said, because it's giving me heavy menstrual flow, that the only option is to do surgery and remove it so that I can be free from it. And he now booked me last week Friday. On Wednesday, I came to run test prior to the surgery. So Friday, I entered theater and did the surgery successfully by God's grace.
How do people make payments?
Oh, we have actually made payments for our scheme very easy. You pay 12,000 naira per person, but then for the informal sector, you also pay 500 naira for the identity card because you have an enrollee ID card, which is a one-off payment. Okay. So we had never talked about per individual. Okay. So you can carry your card and go to the hospital. Okay. Now the 12,000, which is a premium, different portals. We have recently established offices in all the 21 local government headquarters. There is an ASHIA desk attached to the office of the primary health care coordinator in all the local government headquarters. So the easiest thing to do is to get in touch with whoever is the PHC coordinator, the HOD for primary health care in every local government, and they lead you to who our desk officer in those local governments are. At those points you meet them, you could have access to paying by transfer into our bank accounts. The other thing you could do, that's if you so wish, would be when you are in our office in Oka here to pay with a POS. But then, to make life even very easy, on our website, www.asia.an.gov.ng, if you log on, you can pay using the InterSwitch Pay Direct Payment platform. So, within the comfort of your bedroom, you could actually go on our website and then you make payments, and a reference code will be sent to your email, which you will bring to us for verification, and then we enroll you anywhere across the 21 local government areas where we have offices.
People choose the hospitals of their choice.
Oh yes, you choose any hospital of your choice. Okay. But then If you don't want to do any of those, you're not on the social media and all that, you can go to any bank at all in this country and tell them you need to pay the premium for Anambra State Health Insurance Scheme on Pay Direct platform. And you pay and they give you the reference code and you come to us, we register you again. It's that simple.
I registered at Secretariat in Oka. That was sometimes in November last year. There was no hassles at all. It was as easy and smooth as whatever you can talk about. I was issued a card. This is it. This is the card. Actually, you can even see that I'm even here just to assess their facilities here. And I've been here for over a week now. And their services are okay. It's better you experience it than somebody tells you. Unlike the conventional coming to the hospital, whereby you pay for the card, you pay for lab, you pay for this. Majority of these services are free to us. The experience is just okay. Like as you can see, this is my wife here. She's an indirect beneficiary just because I registered with it. And now she's even assessing it. We are here to see the doctor. And because of that, you can see the multiplier effect of this ASHA program.
Has the federal, I know this is a new, this is new in Anambra State. Has the federal government been a part of it?
Yeah, thank you. I want to cast our minds back to the fact that this scheme was launched formally by His Excellency Chief Willie Obiano on the 14th of September 2018. The Executive Secretary, the Executive Secretary, National Health Insurance Scheme, Professor Yusuf, was there himself. He wasn't represented. Okay. The Minister for Health was represented in that event. Everybody we needed from the federal level was there. Okay. WHO was there. So this is a team that was born really out of the country's desire in the National Strategic Health Development Plan 2 to make sure that health insurance becomes decentralized and encourage states to go and own theirs. And Anambra has keyed into that. Okay. The Basic Healthcare Provision Fund, Anambra has met all the criteria to be included. Anambra has been brought on board. So, and that's a federal government initiative. All of this is because, yes, the federal government is fully aware of what we are doing. And currently we have about 34,000 lives enrolled into our scheme. Assessing care, not just enrollment. Because some of our sister states have just started enrollment, but they haven't started rendering services. Thank you.
So that's it on Eyewitness Chat. We've been talking with Dr. Simeon Onyemaechi, the Executive Secretary, Anambra State Health Insurance Agency. And he's explained how we can bring affordable, accessible, and effective healthcare services to everyone that resides in Anambra State. Thanks for being with us.
The equipment that we were eyeing that we couldn't afford, the insurance has provided us with enough cash to supplement what we already have. Because you have enough money to do a number of things that we couldn't do before. If you look beyond, you see what the orthopedic people, we procured those orthopedic equipment from the health insurance. Some are in the ward, the orthopedic bed is in the ward, orthopedic foam, the cutter, cast cutter, and these things. It looks, you wouldn't appreciate it unless you're on the scene.
Simeon Onyemaechi, Executive Secretary, Anambra State Health Insurance Agency. I'm a witness that His Excellency Governor Willie Obiano is willingly working.
With all our hearts, we pray and ask, God bless Anambra, God bless the shining light that we bear. We're the only ones to make her brighter, the only